Hi Beverly, my name's Allison. I'll be your PA today.
Hi.
Nice to see you.
You too.
So what's going on? What brought you in today?
I've just been feeling really tired and weak lately.
Okay. How long ago did this start?
I noticed it for I don't know, 3 or 4 days now.
3 or 4 days?
Mm-hmm.
Okay. And is there anything that you think started the symptoms or?
I don't know, I just play a lot of sports and I can just tell that I've been really tired now during the games and I can't really make it through class without wanting to fall asleep.
Okay. All right. So is there anything that you've noticed makes this tiredness better or worse? Do you take naps throughout the day? Does that help at all? Or
Well, I try not to, but I just try not to do as much during my practices, and I've been not paying attention in class, but
okay.
nothing really makes it better. I've been trying to go to sleep earlier, but that's about it.
And that's not helping? No? Okay, have you ever experienced this before?
No.
No? Okay. And how long, you said this happened a couple days ago?
Mm-hmm.
And, okay, so it's just a tiredness. Are you feeling achy at all, or?
My stomach hurts sometimes, my whole, this area hurts.
Okay, so your abdominal area,
Mm-hmm.
does it radiate anywhere? Does it go lower? Does it go to your back at all?
No.
Up in your chest? Do you have any chest pain?
No.
No. Okay.
It's just my stomach.
It's just abdominal pain.
Mm-hmm.
Okay. Are you on any medications?
Just birth control.
Birth control?
Mm-hmm.
Okay. And do you use any recreational drugs? Any borrowed drugs? No?
No.
Any vitamins?
No.
No. Okay. Any herbal supplements?
Mm-hmm.
No. Okay. And do you have any allergies? Any allergies to medications or to environmental factors?
Nope.
No. Okay. All right. So you said you've been having this abdominal pain, so I'm just going to ask a couple more questions about any other symptoms that you've been having.
Okay.
This weight that's on your chart. Is that your usual weight? Would you say?
It's a little bit lower than what I usually am. It's about
okay.
I don't know, 5 to 10 pounds lower than what I usually am.
So you've noticed a weight change?
Mm-hmm.
Okay, and how long ago did you notice that you started to lose some weight?
It's only been a week or two.
A week or two?
Mm-hmm.
Okay, and have you been eating less, or have you any experience with eating disorders or anorexia, bulimia?
I just really haven't been as hungry as I usually am. I just haven't been eating as much, but
So
it's not because I do it on purpose.
Okay, so you don't have as much of an appetite. So.
Yeah.
Okay. All right. So any fever or fatigue?
Yeah, I've been feeling tired.
Fatigue. Okay, and weak. You said.
Mm-hmm.
I
don't think I had a fever though.
No. Okay. Any night sweats or chills?
No.
No. Okay. All right. So I'll just ask a few questions about your past medical history just to get a little better of an idea of what might be going on.
Okay.
You said you haven't had symptoms like this before.
Mm-hmm.
In your childhood, are you up to date on all your immunizations?
Mm-hmm.
Okay. Did you have chickenpox?
Yes.
Did you have the vaccination?
Yes.
Yes. Okay. All right. Any surgeries in your childhood?
Oh, well, I had my wisdom teeth out.
Okay. And how long ago was that?
I was 18.
And what hospital?
I don't know. It wasn't at a hospital.
Okay, it was at a doctor's office.
Mm-hmm.
Okay. And were the results good?
Mm-hmm.
No complications? Okay. And any hospitalizations?
Nope.
No. Okay. And do you get a flu shot every year?
Maybe not every year, but usually.
You usually get one? Okay. All right. And do you regularly see an OBGYN?
Mm-hmm.
Every year?
Yes.
And do you get pap smears done?
Yeah.
Yes.
Since I was 18.
Okay. So when was your last one?
Probably 3 months ago.
And what were the results? Were there any abnormalities?
Nope.
No. Okay. All right. And then a little bit about your any disorders or diseases that may be in your history. I'll just ask you a small list and just say yes or no if you recognize any of them. So, COPD?
No.
Coronary artery disease?
No.
Cancer?
Mm-mm.
Diabetes?
No.
HIV?
No.
Hypertension?
No.
Any hepatitis?
No.
Kidney diseases? Or thyroid disease? No. And do you notice any of those diseases in any of your family history?
My dad has hypertension.
Okay. So just your dad. Any are both your parents living?
Mhm.
And you have a dad and a mom?
Mhm.
Okay. And grandparents?
Yeah, they're all living. My grandparents on my dad's side just smoke a lot, so my grandmother had a stroke, but that's about it.
Okay. Any okay. So your grandma had a stroke, your dad you said has some hypertension.
Mhm.
Okay. And these symptoms that you have now, has anybody else in your family noticed that they had them before?
No, I don't think so.
No. Okay. All right. And I'm just going to ask a little bit about your sexual history. I asked all my patients this just to make sure that they're being safe and just to get an idea. So, are you sexually active?
Mhm.
Yes. And with men, women, or both?
Men.
Men. Okay. And do you use protection?
Yes.
And what kind of protection do you use?
Condoms.
You use condoms? Just
Yeah.
condoms, and you're on the birth control too?
Mhm.
Okay. Do you use condoms regularly, all the time?
I would say like
Most of
the time.
Okay. All right. All right. And then a little bit about your. Well, do you have any history of STDs or STIs?
No.
No. Okay. A little bit about your social history. Where were you born?
In Maryland.
In Maryland. Okay. And you
That's
lived there
awesome.
your whole life?
Mhm.
Okay. And are you currently working? Are you a student?
I'm a student at Philadelphia University.
Okay. And what do you study there?
To be a physician assistant, I just started my graduate year.
Oh, good for you. Okay. So who are you living on campus there, or are you living off campus?
I live off campus with 3 roommates.
Okay. And do you have? Would you say you have a pretty good support system with family and friends?
Mhm. My family is 3 hours away, but we have a good relationship.
Okay. So you're still able to see them
Mhm.
sometimes. Okay. And then what about your house? Do you live in a one-story house?
So we live in like a 2-story house.
Okay. All right. So how many steps are in your house?
I don't know. It's just
Okay,
like
2
1
stories.
story.
Okay. And do you have smoke detectors and
Mhm.
okay, and carbon monoxide detectors? Yes. Okay. And do you drive to campus then?
Mhm.
Okay. And do you wear seatbelt?
Yes.
Okay. Do you ever ride bike?
No.
No, you don't. Okay. All right. So you said you just started PA school. So what is your stress level like?
Well, it's starting to get more stressful currently, but I
Okay.
think it's okay.
And how have you been dealing with the increased stress?
I study, but then like I try and hang out with my friends and not worry
So a good
too
balance.
much. Mhm.
Okay. And then what about your diet? Has your diet changed at all? You said that you haven't. I mean, not relating to this, but what
Okay.
would a typical meal look like for you when you're not experiencing these symptoms?
I usually just have a bagel and yogurt for breakfast and have a sandwich with some snacks at lunch, and then usually just have like chicken and vegetables for dinner.
Okay.
That's usually what I have.
Okay. So pretty healthy.
Mhm.
What about any exercise?
I try to exercise, but
How many
sometimes.
times a week would you say?
Depending on the week, probably like 2 or 3 times a week.
Okay. What about any caffeine intake, chocolate, any teas or coffee?
No, I really
No.
don't drink caffeine that much.
Okay. And then how much water would you say you drink a day?
Well, I usually only drink water because I don't like Pepsi or anything, so I think I drink a good amount.
Okay, so you stay pretty hydrated.
Mhm.
Have you noticed that you're drinking less water now that your symptoms have?
I'm not sure. I think it's just the eating. I
Okay.
haven't been as hungry.
Okay. And so you're a college student. How often would you say that you drink in a week?
Probably like once every weekend.
Once every weekend. And how many drinks would you say?
Probably like 5 or 6.
5 or 6? Okay. And any tobacco use or
No.
illicit drug use?
No.
No. Okay. All right. Well, I think that about wraps up what I need to know from you. I'm going to try to get some tests done and do whatever I can to figure out what's going on with you and get you better soon.
Okay.
All right. Thank you.
Thank you.